What doctors want you to understand before using prescription drugs off-label. Medications that were once prescribed strictly to treat illness are increasingly being used to prevent disease. Specialists explain why this shift is happening and what scientific evidence actually supports it. As telehealth platforms and direct-to-consumer pharmacy services become more widespread, gaining access to prescription medications has become easier than ever. As a result, more people are beginning to view these drugs as part of a broader strategy for maintaining long-term health. Deborah M. Cotto says that whenever she attends social gatherings, people frequently ask her which medications they should be taking or what she thinks about drugs promoted for longevity. "I consider myself a soft biohacker," says Cotto, a physician, professor of geriatric medicine, and co-director of a leading longevity research center. Since the beginning of human history, people have feared aging and death and searched for ways to delay or even escape them. For decades, that desire largely fueled the booming supplement industry. Today, an estimated 3 out of 4 adults in the United States take dietary supplements such as omega-3s, vitamin D, or creatine. Now, however, attention is shifting beyond pills and powders sold over the counter. An increasing number of individuals are turning to prescription medications in hopes of enhancing health and slowing the effects of aging. Examples include GLP-1 drugs like Ozempic, originally developed to manage diabetes, but now commonly used for weight loss and being studied for a range of other conditions. Rapamycin, first used for organ transplant patients, has gained attention for its supposed anti-aging properties. Testosterone replacement therapy is also sometimes marketed as a way to boost performance or extend vitality. Cotto sees this trend as the next stage in how people try to take control of their health. Although prescription medications are traditionally harder to obtain than supplements, telehealth services have lowered many of those barriers, reshaping drugs into lifestyle tools rather than treatments of last resort. The appeal is understandable. Prescription drugs are regulated, measurable, and supported by clinical research, something many supplements lack. For people who feel underserved by traditional healthcare systems, access to these medications can feel empowering. Still, the risks are real. Many of these drugs have not been approved or thoroughly studied for preventative or off-label use. Research has also linked taking a higher number of medications with increased mortality risk. As Cotto notes, many of the centenarians she encounters take very few medications, often fewer than 5. So why are prescription drugs increasingly being framed as tools for prevention? One reason is cultural. According to Arthur L. Kaplan, a prominent medical ethics expert, this trend reflects today's fast medicine mindset. Many people want to believe they can avoid hard work like exercising regularly or maintaining a balanced diet. Instead, they search for a quick fix, a pill, supplement, or shortcut that promises the same benefits. Jennifer Schrack, a specialist in aging and health, agrees that the idea of a pill that promotes long-term wellness is naturally attractive. She jokes that if a drug ever truly replaced exercise, her career would be over. While future medications may one day support healthy aging in meaningful ways, there is currently no strong evidence that these drugs can significantly extend lifespan. What research consistently shows is that physical activity, social connection, and mental engagement play a crucial role in aging well, though many people want something more. Economic forces also play a major role. In the United States, pharmaceutical companies are allowed to advertise directly to consumers, unlike in many other countries. As a result, people are frequently exposed to marketing for prescription drugs, especially on social media. Companies recognize that consumers want control over their health and the promise of living better for longer. According to Cotto, they often capitalize on that desire, even when strong medical evidence lacks.